My name is Barry Davis. I'm Chief of Division of Cardiothoracic Surgery at Greenville Hospital System. Cardiothoracic surgeons, they perform surgery on the heart and lungs, major blood vessels in the chest, and other organs in the chest. Patients with valvular heart disease have either the valve will not open very well or not close very well. And typically patients have symptoms, and those symptoms are really three major symptoms, which include chest pain, dizzy spells, or heart failure symptoms such as shortness of breath. Once you develop these symptoms with valvular heart disease, surgery should be considered. Valve surgery incorporates, there are two different types of operations for valve surgery. One being actually removing the valve and replacing it with either an artificial valve, either a mechanical valve or a tissue valve, or refixing the valve, repairing the valve. Typically, you have two major valves that are operated on, the aortic valve and the mitral valve. The aortic valve usually is replaced, very rarely repaired. The mitral valve, if it's for a leaky valve, we prefer to repair it because patients do better in the long run with repair valves versus replace valves. First of all, my specialty is minimally invasive valve surgery. Patients who undergo minimally invasive valve surgery typically will have a small 2-inch incision that's either hidden under their breast or just to the right of their sternum. After the small incision is made, the valve will be repaired or replaced as the standard operation would typically do, including using the heart-lung machine. The operation typically takes several hours. After surgery, the recovery time is with minimally invasive surgery is actually several days shorter than you would expect for the open standard operation. With the standard valve surgery, patients, when they're undergoing valve replacement or valve repair surgery, typically you're in the hospital on an average of 7 to 10 days. Patients can expect, once they go home, if you perform surgery through the standard incision, typically a 2-month recovery period prior to them getting back to normal. If it's through a minimally invasive approach, typically patients are back at full activity within 3 to 4 weeks. The cardiovascular team at Greenville Hospital System is the most experienced in our area and one of the most experienced in the Southeast in minimally invasive cardiothoracic surgery. We have excellent short and long-term results, which has been demonstrated in multiple national databases. If you have a condition that requires cardiac surgery, please contact the Division of Cardiac Surgery at Greenville Hospital System to see if you're a candidate for the minimally invasive approach.